Hi guys, so today's video is going to be on how to deal with angry, agitated patients and or family members. And being a new nurse, these situations really scared me. I really was just waiting for that moment where I'd have a patient that was angry with me or a family member that was angry with me, and I wasn't quite sure how I would handle it because I am a very non-confrontational person. I don't like anger, I don't like yelling, I'm a very matter-of-fact, let's just talk it out and figure out how we can deal with this. And so I was worried that if I ever had a patient or family member approach me and was angry with me or with their care, on how I would handle it. So a few weeks ago, I had a situation where the patient and family member were upset, and they were upset with me, but really a lot of times patients aren't really upset with you. They have been in the hospital for a few days. They've just been reminiscing on this one thought that, they're upset about, and they just let it build, and they're emotional because they're in the hospital. They're in a vulnerable state. They're getting bothered throughout the night, so they're tired. And then there's maybe a little something that happens that sets them off, and you may be that nurse that is on that shift where your patient just tips over the edge or the family member tips over the edge, and all of a sudden they are upset with you. So I think one of the biggest things to do if a patient or family member is upset with you is to stay calm. Don't get defensive, don't be angry back, stay calm, take some deep breaths. And if you don't know what to say, repeat to them how they are feeling. And that's kind of what I did when I was approached with a situation a few weeks ago. Is the family member was upset, and all I did really is say, I see that you're really upset right now. I apologize that you are frustrated. What can I do to help this situation? Or what can I do to make it better? And really, that's a very simple thing to say, and you can apply that to a lot of situations with patients if they're frustrated with you. You just regurgitate back to them how they are feeling. And of course, make sure you're maintaining your safety. If a patient or a family member is getting very out of control, you need to call for help. You need security there, or another charge nurse, or your supervisor there, or someone to kind of back you up. And if a patient is just getting super upset, or family member is getting super upset, and nothing you're doing or saying is pleasing them, then you can say, you know what, I'm going to bring my charge nurse in and see if they can talk with you. I'm going to bring my supervisor in and see if they can talk with you. Because even though your supervisor or charge nurse might say or tell the patient or family member the exact same things that you just said or did, sometimes coming from someone higher up just makes them realize, oh, okay, well, if the supervisor or charge nurse is saying that, then I guess that's how it is, or So I feel a lot more comfortable with situations now where maybe a patient is really angry with me or agitated, or maybe they have dementia, maybe they're confused, maybe they, they're not trying to be like that. And most patients and family members, they're not trying to be like that. They just have been emotional, they've been tired, they're going through a lot, and you happen to be that one person there that they are going to release all their steam on. It's really important that you don't take it to heart. That is one thing that I worried about, is that whenever I had a situation with an angry, upset patient or family member, that I would go home and kind of reminisce on it and feel guilty or bad. And I was really surprised and shocked at how well I was able to in my head be like, you know what, I know they're not angry at me, they're angry at the situation, they're emotional, they're going through a lot, and I just happened to be that person that was there when they got upset. And so I knew it wasn't me. I knew I had done everything I possibly could to try and avoid the situation or help the situation once it happened. And in the end of the day, you can't let that weigh on your shoulders, because it happens. People get upset, and they usually don't mean to be upset with you. Also, it's important to keep in mind that if it's a family member that is being disruptive or angry or yelling or creating a hostile environment, you do have the right to ask them to leave or ask security to escort them out, because in the end, it's all about your patient. And sometimes you'll have a calm patient but a frustrated family member, and it's not creating a healthy environment if you have a patient who's there and their family member is being hostile or disruptive to you, it's disruptive to the patient. And so if you run into that situation where the health or safety of anyone is being compromised, then remember to call security, remember to get extra help, and call for your higher up nurses or supervisors. I hope this video gave you guys a little insight or light on, how to deal with angry patients or family members, because it is something you're going to come in contact with when you are a nurse. I'm sure if you work, at a retail store or a restaurant, you're going to come in contact with this as well. It's the same thing, just, a little different, because you're dealing with people's health, and that's a very sensitive subject to a lot of people, and people get very emotional over that, which is understandable. Thank you guys for watching this video. Leave me a comment in the comments below. Have you ever dealt with an angry patient? How did you handle it? How did you feel? Give this video a thumbs up and subscribe to my channel, and I'll see you guys next time. Bye.